Should I go? Good morning, everyone.
Good morning.
Good morning. I am so happy and proud to be here today with my good friend, First Lady, Dr. Jill Biden. As we come together to highlight how the United States and African nations are strengthening our partnerships to advance our shared priorities. The United States is deeply committed to building our cultural exchanges and ties with our African partners. And I'm honored to be here today to discuss working with each of you to address health inequities, advance women's, youth, and gender equality, issues that are so important to Dr. Biden and myself. Dr. Biden, through her amazing work to end cancer, has been a tireless champion for addressing health inequalities and investing in forward-thinking cancer research. She has met with researchers, patients, and doctors all across the world. And I know these issues are so important to many of you in your home countries. Together, with our nations working hand in hand, there is nothing that we cannot overcome, and there is nothing that we can't do. Engagements such as today are personally meaningful to me. I recently visited Thailand and attended the Asia-Pacific Economic Cooperation, or APEC, spousal program. The other spouses and I talked about our relationships between our countries. And throughout the day, as we spent that meaningful time together, our connections grew stronger. And just last week, I hosted our United States Senate spouses here in Washington, and I was struck in both of those events the similarities to the spouses event in Thailand and the event here. No matter who we are, where we're from, what our differences are, we are all as spouses united in our love for our countries and our love for our spouses and our commitment to public service. And we all know that these roles are unique. To be married to someone in public service, someone who has put themselves out there, especially at this level. And we all know what it takes to be in government office and what it takes to support those spouses in those positions. But every time I'm around a group of spouses, I always feel a sense of hope. I always feel a sense of partnership. And that while there's always more work to do, we will all do it together. And that is a feeling of hope that I hope we all leave here today with. Yesterday, my wife, the Vice President, Kamala Harris, joined young African and American leaders at the African Diaspora Young Leaders Forum. In her speech, she emphasized the fact that the creativity and ingenuity of Africa's young leaders will help shape the future of our world. Our youth, both here in the United States and all across Africa, are leading the way. And I'm honored to be here to introduce to you someone who is a perfect example of that leadership. With us today is Kalkadan Tedesia, a USAID Young African Leaders Initiative, YALI, alum. Kalkadan started an Ethiopian-based company, Happy Pads, with her sister, Rubit. And I'm going to let Kalkadan tell you more about what it is and why they founded it and what they're doing. But I'll say this, we are all inspired by you and your sister, your talent and your ideas, and I'm proud to introduce to you, all of you, our next speaker, and a leader for generations to come, Kalkadan Tedesi. Thank you so much.
Thank you. Good morning, everyone.
Good morning.
Okay, when I was in university in Ethiopia, I noticed in our dorm many mattresses were torn and ripped. I was confused. So as a general secretary for the student union, I decided to talk to the proctors to see what was going on. They told me that the young women who can't afford to buy the sanitary parts were tearing strips off the mattresses to use when they are menstruating. At the same time, I was facing issues during my menstrual cycle, which was allergies to sanitary pads. I learned that the available pads are 90% plastic and harmful chemicals. I started researching and saw that in other countries, there are natural biodegradable sanitary pads as option. But in Ethiopia, as in many of the African countries, lack of affordable and quality sanitary pads is a health issue. So that so many women face. Given the situation, I asked myself that can be done. With my sister Rubit, here with me today, we started doing research into alternatives that would be safe to use. We began to look at banana tree stems, how we could use the fibers for a better and safer sanitary pads free from chemicals and plastic. Using these materials, we created a sanitary pad is chemical and plastic free and will degrade within 6 months of disposal. Ideas are hard to make real, so I applied and was accepted to the Young Africa Leaders Initiative, which is called YALI. I entered the business and entrepreneurship track, where I learned that my idea could become a business. The training gave me a network of the other young African entrepreneurs who shared their experience in starting a business. This network showed me that I'm not alone and that there are other young African women with good ideas just waiting to become a business. We had mentors and coaches helping us along the way, and this year we won the HP World Skills Be Changemaker 2022. This award gave us some small funds and support to help jumpstart our idea to make reality, and it gave us a confidence and faith in ourselves that they believe in our idea. I'm sharing this story so I can also inspire other young African women to not give up on their dreams. I was motivated by other women before me, and I hope I can motivate other women who come after me. It's not easy to start a business as a young African entrepreneur, especially as a woman. I would like to tell others not to give up, even though there are many obstacles. I would like to encourage other young African women to seek out mentors who can help share their experiences, and for young women to apply for leadership programs such as YALI and Be Changemaker. Follow your dreams like we did with our idea, and follow in the footsteps of the strong women who paved the way, like so many of the strong women in this room. This is an honor for me to be here today, and thank you all again. You're warm welcome, and now I'm honored to introduce the First Lady of the United States, Dr. Jill Biden.
Thank you. Good morning, and thank you, Kalkadan. What an inspiring story. You know, I met so many young women entrepreneurs when I visited so many countries in Africa. And you and your sister, oh, where'd she go? She came over to sit with you, I'm sure. Oh, there you are. Show us that when we invest in our young people, you go on to make your communities better for everyone. So thank you, both of you, for all of your work. And I'm so grateful to Deborah and the Kennedy Center team for opening the reach for us today. So Deborah, I know you're here somewhere. Well, thank you. And Doug, thank you for your kind words. You know, you always use your voice to speak up for what's right. And we're grateful for your partnership in this administration. You know, the President and I have been looking forward to welcoming you and your spouses to Washington, D.C. So I'm honored to be with all of you here today. You know, when my husband Joe became president, I made a promise to myself that I would never waste my platform. I wanted to use it to shine a light on the issues that I work on, that I have worked on for so many years. I've supported military families, lifted up community colleges and education around the world, and advancing the fight against cancer. And I saw how our country really needed healing in so many ways. And I know that I wasn't elected, but I knew that I had a part to play. And as spouses, we serve the people of our countries too, don't we? And we see their hearts and their hopes. We witness the small miracles of compassion and generosity between neighbors. We know what can happen when communities come together, and how much can change when we work towards a cause that's really so much bigger than ourselves. And there's no one way to approach this role that we have as First Ladies. It's a unique experience that few people really understand. And that's why this summit and the partnerships that we're all building here matter so much. All of us have something to share with this group, and something that we're going to learn as well. Because as I see it, we are all connected. Around the world, we've seen challenges that affect us all. Think about them: hunger and violence, poverty and climate change. They aren't contained by borders. We've also seen that when we invest in our communities, our young people, like these two, are able to find more opportunities to succeed. When girls can learn to their full potential, they can become the leaders and innovators that we all need. Through the Cancer Moonshot, our White House initiative to transform cancer care and save lives, we're bringing together international partners to share innovative ideas and practices and work together to ease the burdens on patients and create new ways to treat diseases. And I know, if you're like we are, like the Biden family, I probably know that each and every one of your families has been touched by cancer in some way. And when doctors work and researchers work across borders and industries, they can make breakthroughs that save lives around the world. And as the Cancer Moonshot expands its engagements, we are focused on how we can play our part in really a global effort. And that's why the U.S. government and our private sector partners are committing over $300 million in programs and new initiatives to prevent, diagnose, and treat cancers across the African continent. And as Second Lady, I had the opportunity to visit the continent 5 times. So I was probably in many of your countries. And the memories I made there have stayed with me, and I've looked forward to visiting again. And during these 2 days, we will share some of the food, art, and culture that brings the United States enormous pride. And as you experience what makes our nation unique, I hope you will also see just how many things we all have in common. And I hope we're reminded that our differences are precious and our similarities are infinite, because our future will be built on that shared ground. There's a quote that I love, I admire, and many of you probably know it. It goes like this: I've learned that, people may forget what you said, but they will never forget how you made them feel. We may not remember every word that is said here today, but my hope is that the way we make each other feel will last beyond this summit, that the friendships that we find will be meaningful and memorable for years and years to come. Now, today we're going to discuss cancer, but I hope you will also share your work or experiences breaking down barriers facing women and girls. So once again, it's my honor to welcome you to our beautiful, although some of you have told me it's a little cold, Capitol. And I'd like to introduce you to our next speaker, and I hear that many of you may know him. He's been a champion for global health for more than 3 decades and is leading PEPFAR. Please join me in welcoming Ambassador John Nkengasong. John, come on up. Thank you for being here.
Thank you.
We tried to match today.
Thank you so much, First Lady, Dr. Biden. And what an honor and privilege to join this conversation, which is truly going to be a conversation to learn from you all, your experiences and the leadership that you all exercise in the various countries in Africa that I know so well. Until 6 months ago, I was at the African Union serving as the founding director of the Africa Centers for Disease Control and Prevention. And I know so well the issues that Dr. Biden has just expanded on. But let me center the discussion or start the discussion around young women, adolescent girls, and access, the challenges that they have in terms of access to care. And very importantly, just remind you all what PEPFAR has done, as Dr. Biden said earlier, over the last 20 years, thanks to the PEPFAR that you all are aware, we've invested more than $100 billion to fighting HIV/AIDS in Africa. And in February, we'll be celebrating the 20th anniversary of that amazing program that has truly changed the face of HIV/AIDS on the continent. I say that because it has also enabled a platform that is allowing us to address the cancer challenges in several countries in Africa through the different partnerships with the private sector, and I'm pleased that they are here today to discuss with you all. It is my hope that we will have a very lively learning conversation, as the First Lady have said, that focuses on the dreams of what young women, girls in Africa, what we can do together to continue to provide them hope. Kakidan just talked about dreams. And let me tell you about another dreams that we are doing, which is not that same dream, but incidentally, she mentioned the word dreams 3 times in her remarks. And dreams is a program that we set up as part of PEPFAR. It stands for Determined, Resilient, Empowered, AIDS-free, mentored, and safe for young girls. And we've invested each year $2 billion in supporting access to care, HIV prevention, and treatment in young girls and adolescent women in Africa. And the data shows that almost 3 million young girls have access to this program in several countries in Africa. And we are using that platform also to expand cancer treatment, cervical cancer testing, diagnostics there. So that's why I wanted to bring up the relationship between the cancer discussion we're going to have here, prevention and treatment, and HIV/AIDS that you are so much aware of. I know the First Ladies have an association where they all come together to fight HIV/AIDS, and it has been extremely powerful over the last close to 25 years in the fight against HIV/AIDS on the continent. So I'm hoping that we will start a conversation now that is free-flowing. There's no wrong answer to it. There's no right answer to it. It is just a learning platform, so that at the end of it, we begin to understand how we can work together in an innovative way, in a way that we can define things that we can do collectively to advance access to care in young women, adolescent girls, and very importantly, focus that on cancer. There are two sets of people that we have in this room today, the first ladies who are leaders in your own work you do every day, and then the private sector. So we will start with you all, and then again, I will not call any names because I know you can all just take the floor and speak to the issues that the First Lady has framed, but some of you have offered to start making comments. I will now turn to Her Excellency, the First Lady of the Democratic Republic of Congo, Mrs. Tshisekedi, to just share your reflections and your remarks on the things, the kind of work that you do through your foundation. Then we'll go to Her Excellency, the First Lady of the Republic of Liberia, Mrs. Weah, if she is here, did I? Oh, okay, good. So, and then we'll just kind of let it flow, and everyone who wants to make a contribution, sharing their experiences in the areas of cancer prevention, HIV, how they all interrelate in young women, girls, and women will be welcome. So, Excellency.
Mesdames les Premières Dames d'Afrique, chères sœurs, Madame la Première Dame des États-Unis d'Amérique, chère Jill, je suis particulièrement heureuse de pouvoir dire un petit mot sur la question du cancer qui vous est chère, à la fois comme Première Dame de mon pays, mais également comme vice-présidente de l'Organisation des Premières Dames d'Afrique pour le développement OPDAD. De prime abord, je souhaiterais vous faire part, chère Jill, de la vision de l'OPDAD. Nous émettons le vœu d'avoir une Afrique développée avec des enfants, des jeunes et des femmes en bonne santé et autonomisées. Et en tant que Première Dame d'Afrique, nous sommes donc engagés dans la promotion du développement et la réduction des inégalités dans nos communautés respectives au travers principalement des plaidoyers auprès des gouvernements, des décideurs, des partenaires, mais également de la sensibilisation, la formation, l'information et la vulgarisation. Sur la question du cancer, qui est l'une des questions portées par notre organisation, nous travaillons pour contribuer à la réduction de la mortalité prématurée due au cancer, nouer des partenariats stratégiques nécessaires au renforcement des initiatives et les programmes sur les cancers du col de l'utérus. Dans ce cadre, nous avons mené des activités avec des partenaires comme Roche, Merck et OMS, entre autres, et elles ont notamment porté sur la prévention et le contrôle des cancers de l'appareil reproducteur féminin, la prévention, la prise en charge et la lutte contre la stigmatisation de l'infertilité ainsi que du cancer chez la femme. Le renforcement des capacités de communication grâce aux plateformes sociales et l'amélioration de l'accès aux soins de santé par la formation du personnel médical. Tout récemment, et à l'occasion du dernier sommet de Commonwealth, il a été suggéré de consacrer l'organisation comme une championne de la prévention et l'éradication du cancer du col de l'utérus. Chère Jill, chère sœur, partant de ce qui a été constaté sur le terrain et selon mon expérience personnelle, les défis auxquels les personnes vivant avec le cancer sont confrontées peuvent être un manque d'information et de formation, à la fois pour le personnel soignant que pour les malades et les non-malades. Un difficile accès aux soins, des soins coûteux, des infrastructures peu adéquates, une difficile acceptation des malades et un manque d'accompagnement de la communauté, famille, amis, etc. Le plaidoyer est une arme puissante à notre disposition et associée à l'influence de nos positions comme Première Dame. Ce plaidoyer peut permettre justement à ce que des ressources soient mobilisées pour faciliter l'accès aux soins, un accompagnement psychologique soit en place pour les malades et les communautés, un programme de dépistage précoce soit mis sur pied, un programme de vulgarisation et sensibilisation permanent soit établi, une formation du personnel soignant soit en place et un programme de vaccination soit développé pour éliminer le cancer du col de l'utérus. Plusieurs premières dames ici présentes effectuent un travail remarquable dans le domaine de la lutte contre le cancer. Je peux citer ma sœur du Gabon, mais il y a également celle de la Côte d'Ivoire ou encore du Bénin, non présente ce jour. Pour finir, je voudrais dire que l'Afrique est confrontée à plusieurs autres défis, parmi lesquels les violences sexuelles est basée sur le genre. Nous, Premières Dames, sommes en première ligne pour sensibiliser, dénoncer et participer à la prévention des conflits, source de plusieurs formes de violence. Cher Jill, vous avez rencontré notre prix Nobel, le docteur Denis Mukwege, et je sais que la souffrance et la douleur des femmes et filles congolaises ne vous est pas inconnue. Trouvons des synergies pour travailler également sur cette question, car les conflits qui minent l'est de mon pays et un peu partout en Afrique sont un frein à toute dignité de la femme et à tout développement de nos pays respectifs, ainsi que notre continent. Je n'ai pas tout dit. Je laisserai également mes chères sœurs me compléter le cas échéant. Je vous remercie.
So just to say that the microphone is, you can sit where you are and just make your comments, because we all have microphones that are wired to our addresses. So I think we'll now turn to the Excellency, the First Lady of Liberia, Mrs. Weah, to make your contributions.
Good morning to you all. Dr. Jill Biden, my fellow First Ladies, distinguished ladies and gentlemen. First, I want to begin to thank you for hosting this event and for extending this invitation to us to be a part of such critical advocacy dialogue in the interest of health and wholeness for women and girls in Africa. Indeed, this conversation is well-timed. I want to make this intervention by highlighting a bit of the Liberian context regarding the subject matter. In Liberia, as in most countries, health issues at times are not discussed openly, and certain illnesses in the African context are considered taboo to be discussed. Additionally, when one is diagnosed with such illnesses, especially cancer, one is deemed closer to the grave and sometimes stigmatized. Hence, discussing the symptoms and trying to seek care becomes a major barrier. Additionally, many of Liberia's counties are rural, far away from the capital of Monrovia. So accessing quality medical care is a challenge, as the distance from the rural areas, the villages, to the main health centers are long. Especially in the absence of mobile clinics equipped with registered nurse, physician, and the requisite equipment, hence making it difficult for those who need care. That is another barrier. However, we strive to intervene and seize upon opportunities. One of such intervention is public awareness, which is critical. Each year, as I awake at the beginning of the month of October, my health consciousness, particularly relating to women, girls, and cancer, becomes heightened. This is when our collective efforts in Liberia come to bear as we raise the awareness about cancer, but principally breast cancer. Liberians from all walks of life, women, men, girls, and boys, parade to bring greater awareness. As the First Lady, I feel obliged to join efforts that seek to renew the consciousness about breast cancer, for it is always my desire to re-engender a wider awareness as to caution the Liberian populace to take the issue of breast cancer serious. In October of this year, it was a momentous time when President George Manneh Weah joined the breast cancer awareness walk through the main streets of our capital, Monrovia. This ignites so much support and interest and galvanized the entire country's consciousness regarding breast cancer. I then took a moment to recognize all of the survivors and the advocates who had assembled and who have worked so hard and so long to raise money and awareness to fight this disease. What continues to drive me is the courage that I see in the survivors. I told them at the event I stood in awe of their courage and that I was confident that they were more brave than they believe, stronger than they seem, smarter than they think, and twice as beautiful as they had ever imagined. I told them their courage was definitely something to talk about. For many of them, it was their faith that kept them from going, and I told them that as their First Lady, I stood with them. In Liberia, driven by the Liberian government through the Ministry of Health and supported by the collaborating partners, women and young girls are encouraged to know themselves and present themselves for breast cancer screening regularly, for early detection is the key. We have prioritized healthcare in the rural areas, providing access to care, particularly for women and girls who are most vulnerable and at times seems to be forgotten. But there are major challenges, as stated above. Liberia's President George Manneh Weah declared himself as Liberia feminist in chief. Sometimes something that has seen his administration placing women's issue at the forefront, not just in politics, but as well in health. My flagship program, She's You Movement, support the empowerment of women and girls and pushes to remove barriers that kept them disenfranchised, allowing them to find renewed value in themselves with the understanding that they should not accept just being passengers who are told when to get on board and when to get off, but to be drivers who would have a clear map of their destination and hit the pedal until they arrive. We have organized events with young girls in the various schools, pushing them to understand their health and hygiene, teaching them about their menstrual hygiene and breast cancer. Such gathering help them to get to know and understand their bodies, pay keen attention particularly to lumps and masses in their breasts or changes in their skin. As Liberia continues to make great stride in developing a more robust healthcare system, we seek partners to collaborate with and to support the effort to acquire several mobile clinics to be used in our rural areas that will provide the necessary care that would bring true relief to our women and young girls. Dr. Biden, my distinguished fellow First Ladies, gatherings such as this provide a unique moment for teaching and learning, and I'm ever grateful to you, Dr. Biden and President Biden, for the African Leaders Summit, under whose ambit we have been invited to Washington, D.C. Thank you so much.
Thank you so much for those really warm remarks, but very pertinent and in analyzing the issues of access, awareness, and challenges in Liberia. The floor is open to all of us. As I said, the aim is to have a free-flowing conversation. I will ask that if you take the floor, just introduce yourself and share your experience or experiences with all of us. So, Thank you. Yeah, it works.
Good morning to all of you. My name is Mrs. Masisi, Neo Masisi, and I'm the First Lady of Botswana. Let me start off by extending greetings and appreciation to Her Excellency Dr. Jill Biden, First Lady of the United States of America, Her Excellencies First Ladies from Africa, and the First Gentleman. Let me also acknowledge you, Ambassador, and all dignitaries here present. A very good morning to you all. It is my honor to share insights with you, Excellencies, the Botswana experience around breaking down barriers to cancer care for young women and girls as part of the spousal program hosted by yourself, Dr. Joe Biden, at this U.S. Africa Leaders Summit, which is hosted by the United States of America. Let me, like other speakers, share challenges, and I must say the challenges are very similar. After all, we are all human, and most of us coming from the sub-Saharan region, we have very similar challenges. General awareness, I'll speak around cervical cancer. So one of the challenges is that there's low general awareness of cervical cancer amongst youth. And I will speak particularly to the youth because, as you know, in Africa, youth has become the most critical demographic. Our country, certainly Botswana, over 60% of our country is made up of youth. And a little bit more of context, Botswana is a country with a population of 2.3 million, and it's the size of Texas. Just to give you context. The other challenge is that we still have the hard-to-reach areas, which are the rural areas, where healthcare facilities available are limited to a clinic or a health post. And we have further challenges in personnel in manning these health posts because the modern person, average person, wants to live in the city. They don't want to go to these hard-to-reach areas. So having personnel out there dealing with oncology, because I'd also like to touch on the array of just cancers, because cancer is the next threat to humanities, given the NCD burden that's carried and that it's a silent killer. In Botswana, also one of the challenges is that HIV prevalence stands at 20.8%, placing Botswana as third. So we have quite a burden there on HIV. We've had COVID setbacks in that during COVID, a number of health priorities were set aside as resources were geared at dealing with the epidemic. So we're going to see a number of health outcomes where we had actually advanced those and gone far. They are going to slide back because of COVID. We saw travel restrictions emanating from COVID. Therefore, we saw our youngsters or the population were not going for checkups because travel restrictions were in force. One thing also, at the recently commemorated World AIDS Day, youngsters are asking for youth-friendly facilities. They want privacy, and it points at a gap that if young women are to exercise their full powers of agency in issues relating to their sexual and reproductive health and rights, we have to make sure that the facilities are there. What government interventions has Botswana put through to address cancer? As I said, specifically cervical cancer. We've had HPV vaccinations, and these were rolled out to girls between 9 and 13 years since 2013. And I'm happy to say that the vaccination coverage rate has been 89%. It has been achieved. And it is my belief that this could be improved. There's opportunity there. And as First Lady, using that platform, using that voice, this is where one could put their efforts in closing that 11% remaining. And at this point, let me just say, even if we go to 1% remaining, this 1% represents a life, an important life. It represents a future, a dream, like our youngsters were saying. So even if it goes to 1%, it is not enough. We want 100%, and I believe we can do that. We can close this gap given our advocacy power. Secondly, besides the vaccinations, Botswana has gone into public awareness and education through our Ministry of Health, where there was campaigns through road shows, mass media, and these campaigns were geared towards children both in school and out of school, the youth, and the general population. There's also mobile clinics availed to the populations, particularly those in the hard-to-reach areas, in the villages and rural areas. Let me also continue to say, while the current program in the Office of the First Lady does not deal specifically with cervical cancer, it is covered indirectly through the intense HIV/AIDS prevention pillar, which is targeted at young people. Let me share with you that I'm the UNAIDS Special Ambassador for the empowerment and engagement of young people, and under one of the strategic pillars is HIV and AIDS. And what have I done in this area? I went around the country. There were road shows where there were dialogues with the young people in schools, dialogues with the traditional leadership, dialogues with the general public. And why am I mentioning traditional leadership here? In our sort of countries, traditional leadership play a major role in the leadership because they take care of their communities. They're able to call their communities far much easier. And more importantly, there's that relatedness, speaking the same language, and also issues around culture. Let me give a few more numbers here to say with young people, HIV and young people, why are we so concerned in Botswana, besides our population of only 2.3 million? It is because, if I need to give you 2021 figures, the age group 15 to 24, we had infections, 2001 new infections in a year. In Botswana, it's a lot. As I said, our population is small. And of that 2001, 21% were male, whereas 79% were female, just to demonstrate the burden that the young women carry. And as we all know, there is a link between cervical cancer and HIV. To illustrate this further, the link between human HIV and cervical cancer is of particular concern in Botswana, where 1 in 4 women at risk for cervical cancer is HIV positive. This is a number from 2019. Now, let me also touch on windows of opportunity for the First Lady in terms of advocacy efforts. First of all, let me just say that the array of cancers, whether pediatric cancer, cervical cancer, breast cancer, prostate cancer, we could actually use same approaches, even in terms of advocacy, even in terms of getting communities to dialogue around these cancers and lead in the advocacy. But specifically for cervical cancer, what can the First Lady do going forward? Stepping up campaigns to create awareness, such as, and also pointing out the risks of HIV and the cancer and other cancers, and also encouraging youngsters to indulge in responsible sexual behaviors, to realize that certain sexual behavior comes also with taking care of yourself, and therefore screening, so that early detection, we can benefit from early detection. Secondly, what can the First Lady do? I can also embark on phase 2 of those initial road shows. By the way, the road shows were undertaken in 2019, just before COVID-19 hit. So this is the time to go out there and resuscitate this talk around HIV, to emphasize cervical cancer prevalence, so that combined in combining these programs, we can actually get the maximum out of them. Seeing that Dr. Poplock is here from Global Hope, let me also mention that I sit on the International Council of Global Hope, which deals with pediatric cancer. And those first ladies who are in Southern Africa, our hope is that Botswana becomes a hub for pediatric cancer. Ideally, we would have a hospital, and you would come over, patients would come over and be treated in Botswana. Let me close off here by saying that going forward, let not diseases such as cancer be determined, or the survival rate of cancer be determined by our location. I think we can also make it through partnerships, through learning from each other, from sharing experiences with our country. Let me thank again Dr. Jill for hosting us, Ambassador for setting the tone there for us, and fellow First Ladies. Thank you very much.
Thank you so much. What an amazing situation, remarkable challenges, but remarkable leadership. 89% vaccination rate. That is, it tells us very clearly that leadership matters and that we can get there despite the challenges. So thank you for sharing that the Botswana situation. Also to mention that Botswana is one of the few countries that have exceeded their 95 goals. That is, identify 95% of people that are HIV infected, putting 95% of those on treatment, and getting 95% of them viral load suppressed. Thank you for your leadership in that area as well. Let us, the floor is open, and I'm sure that, I want to be sure that I can pick anyone who wants to make any contribution from behind here, any First Lady. Sorry. Okay, wonderful. So the microphone, okay, good. Please, just introduce yourself and then make your comment. Vous voulez intervenir en espagnol? Okay. Fortunately, she's saying there's no Spanish translation, so it's none. Okay. Oui, en français. Okay. So she speaks Spanish, but I'm not sure any.
Give us 1 second, we'll get the interpreter.
Okay. Why don't we move on? Then we'll come back to you so that we get. Let's go to the First Lady of Namibia.
I've got way too much energy, so I'm going to stay and speak. I really want to reflect on something that Dr. Joe Biden said, a decision not to waste her platform. I want to reflect on something Doug and I talked about, of both having been lawyers in a previous life. But Ambassador King-Osang, I also want to reflect on your spouse, who herself was a public health scientist and gave up her career to support yours, and that's really the story of the spouses in this room. Many of us have given up what we're doing in order to be supportive of individuals who've taken up public responsibilities, and I agree with what you said about we cannot waste this platform. It's unearned privilege, it's unearned social capital, and part of not wasting the platform is also spending the social capital. And you spend social capital by having the difficult conversations that my sister from Botswana was talking about in relation to sexual health education, which can be controversial. I know my sister from Sierra Leone, I know my sister from DRC was talking about it. And we did something very similar. We hosted as the Office of the First Lady what many people termed as controversial dialogue, intergenerational dialogue between young people, police officers, life skills teachers, nurses, politicians. And some of the things that came out of these conversations were explosive and ended up in the newspapers, they ended up in radio conversations. And I spent a lot of social capital there because I got criticized a lot, but why are you having these conversations with young people? You can't not break stigma and make any movement on difficult issues without having these awkward conversations. But more than that, you don't leave it at conversation stage. We are currently building a model youth clinic based on our findings. So we were guided by the young people themselves. They led the movement. We call it the Be Free movement. And what we constructed thereafter is what we call an ideal youth campus. And the anchor being an friendly clinic, which deals with adolescent issues from a clinical perspective, but also from a mental health perspective, because I think that's the one intersect that we barely ever deal with when it comes to economic empowerment, managing unemployment-related issues, untreated childhood trauma, family dysfunction. The mental health part is normally lacking. So we've got a clinic where a young girl can come in. If she's experienced sexual violence, there'll be a police officer who can take her statement. There are rape kits that can be administered. There's immediately access to mental health support for her. And she has a guide through the legal system who goes with her to court. Our experience is that young girls who've been raped, often on the side of the young girl, she's alone, and the rest of the family is supporting the perpetrator. And this is why we have such low conviction rates, amongst many other problems. She has access to the economic empowerment pillars as well, who provide access to capital. In my previous life, I ran a private equity fund, and we've translated that experience into enabling young people to access capital and build business with our support. They have access to a STEM center where they get 4 IR readiness skills. They can do after-school tutoring. So it's the full spectrum of support that a young person would need. But there's also incentivization. So before they can do the fun stuff, like in the STEM center and the computer labs, they must build points on their access cards, which includes them going to the adolescent-friendly clinic, just to speak to a nurse, speak to a mental health counselor, or just have quiet time in the Solitude Center. So we do incentivize them to visit what we believe to be the anchor of this foundation, of this youth campus. We open up on the 1st of September will be the formal opening. We finish construction the 14th of July 2023. And the idea is really to use this as a model of how we can scale up work around young people and fixing some gaps when it comes to services for young people that's not judgmental and that shapes attitudes, behaviors, and builds skills and does other important interventions as well. The funding part was what interested me. So we'll also be doing prevention work, a lot of prevention work on HIV, on cervical cancers, on breast cancers. We'll be administering the HPV vaccines. We'll be doing HIV tests. We'll enable young people to access the ARTs from this facility and give them the guidance that they need, that they stay on treatment. But what struck us as quite important is to make sure that government is always involved. Namibia is a 2-term limit democracy. Our time is out, 2025. How do we make sure this isn't a white elephant? We've signed out commodity agreements with the Ministry of Health. We've got the police who really want to be part of the center, who want to pay their own way to be based there. We have the Ministry of Youth and Sport, who've provided the land, and who've given us access to the regional youth centers so that we can toolkit the work that we're doing here in the different regions, because you can't scale up services without government involvement, and you can't be assured of government involvement because politics change, leadership changes, but what gave us comfort is that the intent remains the same. I'd also just like to quickly talk about the Organization of African First Ladies, of which I'm the president of. The first lesson I learned, I went home and I said to my husband, oh, I've been elected the president of the African First Ladies. There's 2 presidents now. He didn't find it funny. So I learned not to make jokes about 2 presidents in front of an incumbent president. But the importance of this organization is really the convening power that it has. First ladies from Southern Africa, from West Africa, from East Africa, from North Africa really coalesce around one entity, put our voices collectively on an issue. And cancer, HIV, is at the crux of that. But more importantly than that, and I think Dr. Biden, Doug, you'll agree with me, there's certain issues that only spouses understand. And I've certainly found there are certain issues I go through that only my sisters understand. I can only speak to them. They understand, they get it. it also enables us to benchmark off each other. I know what the First Lady of Sierra Leone is doing. I know what the First Lady of DRC is doing, the First Lady of Niger, the First Lady of Burundi, of Mozambique, Angola. I know exactly what they're doing, but I can also benchmark my own work and say, but Ghana's doing a fantastic program. Let me incorporate elements of that, because we do have similar issues. So the Organization of African First Ladies really acts on 3 levels. We are enabled to use our collective voices, where we can share personal experiences, but where we can also learn from each other. And the one big learning, we've done a Free to Shine campaign, I think Ambassador King-Hassan, you know of it, where we focused on issues around pediatric HIV, and we're hoping from April 2023 to April 2024 to do another continent-wide campaign where all the African First Ladies who are part of the organization speak with one voice. So I want to thank my sisters for the exceptional work all of you do, and for enabling us to be one powerful voice as opposed to individual voices. Thank you.
Wonderful. What an amazing experience. And we just heard from Botswana what resilient leadership can do. We're hearing from Namibia how innovative leadership can bring a platform that is very integrated, and you can leverage that platform to not just fight cancers in young people, but also bring on board HIV testing and integration. And I take your offer as First Ladies to work on pediatric HIV/AIDS to heart, and I'll be reaching out to follow through on that, because it's a top priority population. Children are really, there's major inequity gaps in getting access to HIV treatment in children, so I'll be counting on you so much taking on your offer. Thank you so much for sharing that experience. So let us, see, there's a hand here again. Okay, good. Just oppose Sierra Leone for 1 second and then go back to
the First Lady of Equatorial
First Lady of Equatorial Guinea. I think we
in Spanish.
Okay, we'll be speaking in Spanish, and we have some translation now. Okay, wonderful. Please, Excellency, the floor is yours.
Muchas gracias por cederme la palabra. Queridas hermanas, primera dama de África, la señora Jill Biden. Voy a ser muy breve. El cáncer cervical es un verdadero problema de salud pública para el continente africano. Es una enfermedad letal que las investigaciones proyectan que de 100.000 mujeres... ¿Qué es con va a hacer?
Traducción, nena, traducción. No tiene traducción, nena.
No, elle vient de me dire qu'il n'y a pas de traduction.
Qui va traduire?
Yeah. Tu peux aller là-bas?
I can go to the room. Okay.
Bueno, por favor, me gustaría pedir algo. En lo sucesivo, cuando hacen una reunión, que sepan que en África no solamente se habla el francés y el inglés. Nosotros también estamos ahí, los que hablan el español. Casi nosotros somos el único país en África que habla español. Que lo tengan en cuenta.
I would like to make a small request. In Africa, we have a lot of countries that they speak French and English, but we, Equatorial Guinea, we are the only African country that speak Spanish. For the next summit, the First Lady would like to request if they can have an encounter, they should have an interpreter in Spanish for her.
Pido disculpas.
I would like to apologize for that.
Decía que en el continente africano es una enfermedad letal que las investigaciones proyectan que de 100.000 mujeres detectadas anualmente con el virus de papiloma humano, más de la mitad corre el riesgo de perder la vida.
The First Lady would like to emphasize the problem, a serious problem that we have in the African continent, the cervical cancer, the papillovirus human virus. Around the estimation of 100,000 women that are detected with this cancer, most of them they die. So it's important that we really focus in that cancer to try to save those women's life.
En nuestros países en concreto nos enfrentamos ante varios obstáculos a la hora de combatir esta enfermedad, entre ellas la deficiencia en la atención médica, la ignorancia y creencia en supersticiones, la falta del hábito de visitas rutinarias y periódicas al médico, y entre otros.
Especially in our countries, African countries, we have this problem of cervical cancer in women because a lot of people, they have the problem that because our culture and people are very superstitious. So a lot of people, they don't have to, the doctor, they don't have access to efficient health, public health, hospitals, so they need all these necessities assistance we require, especially we have women that they don't have the routine to go to the doctor because our culture, our tradition, we are very superstitious. So that really creates this problem, these obstacles in our society, especially for women when they have cancer, because our culture, they don't have that facility that can help them to save them. So for that reason, most of them, sometimes they die when they have this type of cancer. So for that reason, we request assistance, medical assistance to try to solve this problem and to emphasize this problem.
Ante esta realidad evidente, se ha establecido desde el 2017 un programa de campaña de concienciación y sensibilización para garantizar que todas las mujeres de Guinea Ecuatorial estén bien informadas, por un lado, y de la gravedad de la enfermedad, y por la otra parte, de las medidas de prevención y tratamiento del cáncer uterino cérvico, que se ha convertido en un instrumento fundamental para la lucha contra esta enfermedad.
For that reason, since the year 2017, our country have implemented a program to try to sensibilize the women in our country to try to make them have knowledge about this cancer, this cervical cancer that a lot of women are suffering in our country because they don't have the knowledge. So most of them, they are not requiring medical assistance. For that reason, we're trying to sensibilize all these women in our country so they can be conscious that they can get help and that they need to do the medical checkup because it's very important to solve this problem. They have to sensibilize all these women in our country to be aware of this problem.
Como medida complementaria de prevención, estamos suministrando vacunas a niñas de entre 9 y 13 años y enfatizando sobre las visitas médicas rutinarias a las mujeres jóvenes, así como el uso de los preservativos que distribuimos de manera gratuita para evitar las enfermedades de transmisión sexual.
One of the implementation that right now the government is doing in our country to try to prevent this illness is like the government is submitting vaccines from children of 9 to 13 years. They are being facilitating with vaccines. They are doing a medical checkup to all the young ladies that try to facilitate them to instrument and mechanism to know how to prevent transmission of sexual illness. And we are trying to, the most important, to supervise and facilitate medical assistance freely for them to prevent all these transmissional illness in our youth.
Los resultados positivos que han tenido estos programas de prevención sanitaria en nuestro país nos impulsan a abogar por las campañas de información y educación para que las mujeres jóvenes y las niñas puedan acceder a la atención oncológica.
And thanks to since the government started this project to sensibilize the women, especially the young women, about the importance of to require medical assistance, to do medical checkup, we have a lot of positive results from that. For that reason, the government is supporting and is working very hard, making medical campaign, try to reach to the young people, the young women, to have medical assistance, free medical assistance, so that can help them to have knowledge of the problem of this cancer, hurricane cancer that we're suffering in our country.
No podemos combatir este cáncer como en los países más desarrollados por su ventaja científica y tecnológica. La única manera de garantizar la salud de nuestras mujeres es educarlas y dotarlas de las herramientas necesarias para prevenir el cáncer cérvico. Foros como estos nos brindan la oportunidad de intercambiar experiencias y buscar soluciones más apropiadas a los problemas que nos afectan de manera conjunta.
Especially in our countries, we don't have the advantage of the modern countries. For that reason, it's important for us to attend this kind of summit, because in this kind of summit, we can exchange our point of views, we can learn from other countries' experience to how to implement different mechanisms to try to fight with this cancer that is affecting our country. For that reason, it's important for the First Lady to attend this kind of summit, because we learn from other countries' the experience and help her to find mechanisms so they can fight this cancer that a lot of women are suffering in our country.
Para concluir, aguardo esperanzas para que al término de estas reuniones hagamos desarrollado una hoja de ruta común que nos ayude a reforzar la lucha contra esta enfermedad en nuestros respectivos países.
And His Excellency the First Lady, before she concludes, she hoped that after this summit, we will create mechanisms that will help us and they will guide us of how to solve this kind of problem, especially in our country that women suffer a lot of type of cancer, and we don't have the access to the modern investigation, the modern medicine. So it's important when we come to this kind of summit so we can express our experience, so that will help us to get assistance for our country.
África debe crear una concienciación más notoria y robustecer la cooperación sobre este particular ante la gravedad de la situación y por el ritmo crítico y creciente que está tomando esta situación en los últimos años. Y para terminar, me acuerdo hará varios años que asistimos en Nueva York en una misma reunión parecida como la que estamos llevando aquí. La estuvo llevando la ex primera dama, la señora Bush, en compañía con la señora Obama. Estuvieron hablando casi el mismo caso de cáncer. Y me gustaría pedir a mis hermanas si en vez de que todo lo que se habla se quede plasmado en los documentos, si se puede materializar, apoyándonos más.
And the First Lady of Equatorial Guinea would like to conclude that, especially on behalf of the other First Lady of the African country, that it's important to support each other. We have to work together, especially in this problem that is increasing. The problem of women cancer is increasing in a higher rate in the African country. In our countries, it's important that we show solidarity. We work together so we can find mechanisms to solve this problem. And the First Lady remembered that a few years ago in New York, we have a similar summit with the former First Lady, Mrs. Bush, and former First Lady Michelle Obama was at that summit too, and they discussed the same topic about the problem of women cancer in the whole world. And for that reason, the First Lady would like to ask all her sisters that it's important that even though we attend this kind of summit, and we implement everything in document, it's important that we find mechanisms to try to implement that in the real life, because when we come to the summit, we discuss all these concepts, but we put it in the document, but at the end, we cannot create mechanisms that can really help us to solve those problems in our country. So it's important not just to attend this kind of summit, but we have to look for mechanisms so can help us to find solutions.
Wonderful. That was great. Thank you so much for sharing the Equatorial Guinea experience, and especially bringing this cultural context, the superstition that is a handicap for enabling young people to get checked up, and also for offering free checkup for the young population. Thank you so much. What we're going to do, with your permission, is that we've heard we'll come back to the First Ladies, but as part of the solution, partnership is key, as we've heard from all of you. So I would like to pause and go back to some of the private sector that we invited here to just given the time allocation we have, just tell us what they can do to partner with the First Ladies for all of us to solve this problem. And I will start with a colleague from Roche, Ms. Sickler, and just say in 1 minute or so, just share your thoughts on what we can do, because we have a long list, and then we'll come back to the First Ladies, and then we conclude.
Well, thank you very much, and very much appreciate the opportunity to be here. Thank you to the First Lady, second gentleman, and to the Ambassador. And thank you for all of the First Ladies, both for all the work you do, but also for going through a lot of my talking points about cervical cancer, which now makes 1 minute a little bit more doable. You know, we've been active trying in cervical cancer screening for over a decade. And today I wanted to share a project that we're currently working on in Mozambique in partnership with the Ministry of Health and also with US agencies. The goal of the project is to not just screen women for cervical cancer, but also to link them to treatment, because there's no point in spending resources on screening if you are not going to get treatment to prevent the cancer. The goal of this initial project is to screen 12,000 women. To date, we have screened 3,000. Of those 1,200 are positive for high-risk HPV, and of that, 400 required treatment. So these are very significant numbers, and I don't think these numbers are surprising to anyone in this room. But what I do want to focus on is something we've seen for a long time, is just talking about the disease burden isn't enough. We really need to figure out what are the solutions and what are the programs to actually do something about it. So a key part of this program, in addition to highlighting the disease burden, is we're also going to be looking at a lot of cost effectiveness models. What is the cost of screening a woman in these settings? What is the cost of treatment? So we can come in partnership with partners to think about how we can replicate this in other places. Something that I don't know if everyone knows is, PEPFAR has done amazing work across the African continent, and we've been proud to be a partner with PEPFAR since 2012. Many of the diagnostic instruments that are placed all across the continent to do HIV viral load are exactly the same instruments that can do HPV screening. So we're actually a lot closer to being there than I think a lot of people realize. And I think our goal is just to continue the conversations to find those right partnerships, because we would like to work together for a world where national screening programs for cervical cancer are available everywhere, no matter where you live. Thank you.
Wonderful. So we would go to the next private sector partner and listen to Mrs. Sikira from Takeda. And again, just you've heard what the First Lady's first segment now called have expressed, some of the challenges, and maybe you're just offering some opportunities for partnerships. Then after that, we'll go back to the First Ladies. Yes. And continue to hear their experiences.
Thank you so much. It's wonderful to be here and to hear the discussion and to learn what's happening on the ground as well. And thank you to the First Lady for hosting this summit. My name's Ramona Sequeira. I work for Takeda Pharmaceuticals. So we are a pharmaceutical company headquartered in Tokyo, but with a global research hub in Boston, where we do a lot of our cancer research. We are actually a 200-year-old company, and very much a part of our DNA is to think about how we can tailor our approach to the local needs of patients, of providers, of healthcare systems, of societies, and think about how we can build trust as well. So we have a number of programs throughout Africa that we're very proud of, some addressing some of the issues brought up today. So thinking about programs to address women and girls who are the victims of gender violence, thinking about how to make our treatments and care more accessible and available to women and girls who are hard to reach, because we know part of building trust is meeting people where they are instead of expecting them to find us. We have a number of programs, and we'd like to continue to work on that and expand that to address cancer care and medicines. But as we've heard here today, it's so much more than the medicines. It's about stigma and how do we destigmatize being diagnosed with cancer. It's about access to care. It's about trusted advisors. It's about screening and diagnosis and medicines and aftercare. And so we're very committed to continuing that work. I will say we're also working on a vaccine that we hope to bring to everyone. For dengue. So dengue fever is a rapidly growing mosquito-borne disease, and it's endemic in over 125 countries, many countries on the African continent as well. And what happens when dengue sweeps through a community is that the healthcare systems get overwhelmed. It's very similar to what we saw with COVID. And what we've seen as healthcare systems get overwhelmed is that all patients suffer, including those with cancer for whom every day matters. So we look forward to finding, many different ways to address this issue. And I know that the work has to happen on the ground. I know that it takes time, and it takes time to build trust, and we're very committed and see it as our responsibility, actually as a company, to do that work. So thank you again for having us.
Wonderful. Thank you. Thank you so much for sharing that experience. And you're absolutely right. When health systems are overwhelmed, even cancer screening and detection and referral suffers. We've seen this during the COVID outbreak, COVID pandemic, and we heard the experiences from Botswana and Namibia. So let's go back to the First Ladies. I believe there was a hand here, and we'll take on that. Please just introduce yourself and take the floor.
Thank you. My name is Fatima Madabio. I'm the First Lady of Sierra Leone. Madam First Lady, my dear sisters, our second gentleman, and I believe is the most cherished member of our club right now. We don't normally get men in this club, so when we have one, we have to celebrate you. We celebrate you, our brother. First, let me take this opportunity, Madam First Lady, to thank America for a resolution that I put at the United Nations this year. One was for access to justice for rape victims around the world, which was passed in September. Now, rape victims don't have to pay their own legal fee when they go to court. Well, if every country decides to implement it, but that's what the United Nations has approved. And in November 7 this year again, I came back to the United Nations and asked them to give us a World Day for the commemoration and congregation of rape victims so that they can have a healing process, which was also passed, and with the support of America, the Vatican, and Islamic Relief. So I wanted to say, through you, thank you to the people and government of this great nation. My campaign is called the Hands of Our Girls campaign. And the Hands of Our Girls campaign has 6 thematic issues that I try to deal with. One is early marriage. The second one is rape. The third one is trafficking. The fourth one is cancer. The fifth one is infant and child mortality. And the sixth one is HIV/AIDS. But what I have done in the last 4 years being a First Lady is to prioritize what are the root causes for me to be able to get the solution. And I have focused my agenda on rape and early marriage. And the reason why I choose early marriage and rape is the fact that sexual intercourse is another issue when it comes to transmitting the problems that we have as women in Africa. And when you're married off at a very tender age, you don't have an option but to do have you have to have sex with whoever your husband is. And if you're not protected, then you have a problem. And what my husband has done is that my husband has declared free quality education to enable every girl to have the same equal access as boys to education. With that, the girls will be enlightened, the girls will be educated, and the girls will be exposed to the truth. And what my office does behind the scenes supporting my husband is giving those girls the hope that someone do care about them. When I listen to my dear sister here talking about sanitary pad, when I started my campaign, that was one of the things that the girls came to me and told me. They said, we are missing 80 days out of school because we are not able to have sanitary pad. And if you miss 80 days out of school, it doesn't matter which president give you free quality education. You are not going to be in school to acquire that education. So I thought this is a huge problem. And I started providing sanitary pads for our girls so that we keep them in school. Because I believe the reason why the sufferness we have in Africa is lack of education. It's lack of giving girls the access to education. Our population is 51% women. And if you keep 51% of your women in kitchen, you have actually deprived the nation of 51% of your population contributing to nation's building. So that's the reason why I feel very strongly when I speak about cancer. I was in Senegal 2019, myself and my brother here, because the UN appointed me to be the champion for Education Plus in Africa. Myself and President Macky Sall, we started talking to Africa, and then the pandemic came. Unfortunately, with pandemic, they said we can't congregate. But cancer is the second biggest killer in Africa today after malaria. And we have to do something about it. Now, what has my office done? Just this year, because we can't congregate, then unfortunately, as First Ladies, you don't have the power to break the rules because you have to be an example to your people. When they say don't congregate, you can't congregate. So now this year, we've started the HPV vaccine for girls aged 9 to 13. Through Gavi, they donated 300,000 because since 2018, I've been running after them like, look, my girls need this, my girls. So finally, we are able to get 300,000 of that vaccine. Now, 300,000, I think the girls need to have 2 doses of the vaccine to be protected. And we've started the PAP screening also for women who are not going to be taking the vaccine, but then they can screen themselves if there is an issue. We will find a way. As of today, if we have cancer issues that we can't deal with in Sierra Leone, we have to run to Ghana, which is the closest country to us. But how many women actually have that money to go to Ghana? We don't have that. So the president has also decreed that we have to build our own cancer center. And we've started building that. That is what we are doing on the ground now to try and make sure we get our people. When I listen to my auntie here talking about stigmatization, stigmatization is the one thing that is killing Africa because we're so scared to say what is affecting us. We are so scared to talk about the issues that are killing us. We'd rather stay silent. And that silence has been the battle I fought with because I am done being silenced on issues that we need to talk about. We talk about rape. Yes, it's happening in Africa. Let us deal with it. We talk about early marriage. Yes, it is happening in Africa. And through early marriage, you can have HIV/AIDS because those men, they don't protect themselves. They have 3, 4 wives. And if you're taking care of yourself, it doesn't matter how much you take care of yourself, but if the other people are not taking care of themselves, if you end up having sex with the same man, you're going to have HIV/AIDS. So I'm having that conversation with my people and tell them, look, don't listen to anything. Now, if you try to force yourself to marry a girl and that girl go to the police station, we will arrest you because it is a law now. You cannot marry the girl under the age of 18. And for me, even 18 is not enough. But then who am I to say, you know, if I get 18, let me take 18 for now and hope that we will do better. But I believe that if we empower girls through education, if we give them the support that they need to do to be enlightened and expose them to what the world is really about, especially with digitalization, that the whole world today is going to be digitalized. How many of our women know how to even turn on a computer? How many of them even know how to do research on the computer to know what their problem is? These are the things that I'm hoping that from this kind of conversation, we will take back to our homes and tell our women it can be done. There is nothing in this world that cannot be done. If you put your will and your focus on it, it can be done. And I know my sisters here, we work, we are not elected. But I keep from day one when I came in 2018, I keep saying this. If your husband failed, it is you and your husband. If your husband succeed, it's the nation that have succeeded. the burden First Ladies have in Africa is unbelievable. Every crime in Africa is associated with the First Lady. Every success in Africa is associated with the government. When it is the government, they don't do wrong. But when your husband becomes fat, it is the First Lady's fault. When your husband forget to put their tie on properly, it is the First Lady's fault. So if I know they're going to accuse me for everything, why not I use my platform to make the difference that I need to do? So when you're accusing me, you remember me for my platform too. So I want to say thank you for inviting me and for inviting us all here. And we're hoping that we'll come out of this meeting with more enlightenment that will empower us to go and serve our people well. Thank you.
Wonderful. Can't even try to summarize that, but let me tell you what I heard. It says, it can be done if we put our minds to it. So I think that probably summarizes that all. Despite the enormous challenges, if we put our minds to it, it can be done. So the floor is still open. We have time. Okay, good. Please just introduce yourself.
Hello, everyone. I'm Kubita Jagnat, first spouse of the Republic of Mauritius. We're not on the continent of Africa, but very proud to be African. First Lady, Dr. Jill Biden, all First Ladies and spouses, Ambassador John Nkangazong, thank you for giving me the opportunity to be here today, and allow me to give a brief overview of what Mauritius is doing in terms of cancer care and prevention. Sadly, cancer is the third leading cause of death in Mauritius, accounting for 12.8% of total deaths in year 2020. And out of this percentage, more than half related to mortality among women. This trend is a matter for concern for Mauritian authorities, and as a result, our national policy for cancer care and prevention is subject to constant evolution. It also led to the elaboration of our country's first ever national cancer control program covering years 2022 to 2025. This holistic, well-structured program caters for cancer prevention, early diagnosis through screening, treatment, research, and palliative care. The program also takes into account the specificities of our small island, namely our aging population and the devastating effects of climate change. The NCCP thus advocates targeted awareness programs carried out through mass media, but also through school health programs. Prevention remains key in our fight against cancer. Mauritius is thus allocating huge resources for breast and cervical cancer screening, which are the most prevalent types of cancer among women in Mauritius. Some years back, the government also initiated, like many other African countries, the National Human Papillomavirus Vaccination Campaign for girls aged 9 to 12 years. And I'm pleased to say this has been a success, targeting almost 100,000 young girls today. This initiative rests on the WHO's advice, stating that a single dose of HPV vaccine delivers solid protection against type 16 and 18 HPV infections, which cause 70% of cervical cancer cases. Regarding infrastructure, our island's first ever national cancer hospital will be fully operational in 2023. This hospital will be equipped with state-of-the-art equipment with linear accelerators, brachytherapy, as well as nuclear medicine. The success of such initiatives, however, rests on mutual help, and countries like Mauritius remain committed to acquire latest expertise in cancer care and prevention. The United States, Dr. Biden, remain a trusted partner of our country, more so when it comes to the upgrading of our health sector. We welcome all assistance which will allow our health personnel to acquire new skills and knowledge while facilitating access to latest treatments and medical equipment. Before ending, I wish to seize the opportunity to commend First Lady Dr. Jill Biden for her cancer advocacy efforts and the Cancer Moonshot. Thank you, everyone.
Thank you, Excellency, for your leadership in Mauritius in the fight against cancer and for what you do for HPV vaccination. Yes, thank you, Excellency. Please, do you have the microphone?
Hello, everyone. I'm Rebecca Kufuado, First Lady of Ghana. I just have a few remarks, very short ones, on the gaps in cancer and a few recommendations as well. The first gap, I would say, is about knowledge and information. The second is late presentation at medical facilities. The third is lifestyle practices that lead to cancer. And the fifth is cost of treatment. These are the main gaps that I see. And the recommendations I would present here are persistent media campaign to deal with knowledge gap on disease and treatment. Number 2 is mandatory regular checkups every 2 or 5 years, depending on age and family history. 3 is improvement of dietary choices, reduce consumption of processed, fatty, and alcoholic beverages. Number 4 is education and training for health personnel, oncology specialists for timely diagnosis. 5, we must improve early diagnosis and availability of diagnostic equipment. And number 6, we should have concerted national campaigns to vaccinate young girls with the HPV vaccine to prevent cervical cancers. Number 7, to deal with cost of treatment, we must cover all cancers in our insurance benefits package. And I'm happy to state that I got our National Health Insurance Scheme to cover 4 childhood cancers, which make up about 60% of our childhood cancers. These are Burkitt lymphoma, acute lymphoblastic leukemia, Wilms tumor, and retinoblastoma. My foundation, the Rebecca Foundation, also raised money to build a 54-bed hostel for children receiving cancer treatment at our major teaching hospital. This helps to reduce cost of treatment and ensure treatment compliance. And together with Roche and the Ghana Health Service, we are currently conducting education on breast cancer and cervical cancers, training health personnel, screening, referring suspected cases to bigger facilities, and treating early-stage cervical cancers with thermal coagulation machines. This is what I have done in Ghana. I thank you.
Thank you so much, First Lady, for identifying those gaps in a very succinct way and also offering recommendations on how to close those gaps. We'll continue if anyone wants to take the floor. Yes, please. Again, can we move the microphone closer to her?
السيدة الأولى من تونس. السيدة الأولى من تونس. هل يمكن تأمين ترجمة من العربية إلى الإنجليزية؟ السيدة جيل بايدن حرم رئيس الولايات المتحدة الأمريكية. السيدات والسادة، يطيب لي في البداية أن أتوجه بجزيل الشكر لكل القائمين على تنظيم هذه الفعالية، وأن أثمن عالياً الاختيار الموفق للموضوع المطروح للنقاش لارتباطه بهوازن الشعوب القارة الإفريقية بل والإنسانية جمعاء، حيث تشير بعض الإحصائيات إلى أن خطر الإصابة بالسرطان يتهدد حوالي 25 مليون شخص مع حلول سنة 2030. إن المبادرات التي نسعى إلى تحقيقها في مجال مكافحة السرطان لدى الشباب والشابات والأطفال بالخصوص هي تطلعات آمنت بها تونس ولم تتوانى عن الانطلاق في تنفيذها وتبنيها، لا سيما أن التقديرات الأولية تشير إلى إمكانية ارتفاع عدد المصابين بالسرطان في بلادي إلى حوالي 28 ألف شخص سنة 2030 وحوالي 41 ألف شخص سنة 2040. واسمحوا لي بالتركيز في مداخلتي على سرطانات الرئة والثدي والرحم التي هي أكثر أنواع السرطانات المنتشرة في تونس فضلا عن سرطان الأطفال. فسرطان الرئة يهدد حياة الآلاف من الأشخاص في تونس وخاصة منهم الشباب بسبب التدخين، حيث تبلغ نسبة المدخنين للفئة العمرية فوق 15 سنة حوالي 49% للذكور و2.6% بالنسبة للإناث. كما يتوفى سنويا 13,000 مواطن تونسي نتيجة هذه الآفة، نسبة كبيرة منهم من الشباب، فضلا عن التكلفة العالية للتدخين على خزينة الدولة والتي تبلغ ملياري دينار، أي ما يساوي 1% من الدخل الوطني الخام. وقد وضعت تونس خطة متعددة القطاعات لمكافحة التدخين عبر التحسيس والتثقيف الصحي لدى المراهقين والشباب، لا سيما في الوطن المدرسي والجامعي والفضاءات العامة، والنهوض بالتشريعات ذات الصلة على غرار المصادقة على بروتوكول منع الاتجار غير المشروع في مواد التبغ ومنع الدعاية للتبغ بوسائل الإعلام وفق توجيهات الاتفاقية الإطارية لمكافحة التدخين لمنظمة الصحة العالمية. كما تتوفر المنظومة الصحية بتونس على 71 عيادة منتشرة المساعدة على الإقلاع عن التدخين، والتي حققت نتائج مشجعة، حيث بلغت نسبة الإقلاع عن التدخين 32% من جملة المنتفعين بتدخلات هذه العيادات، وفي إطار بلوغ نسبة تقليص التدخين في تونس ب30% وفق الأهداف التي رسمتها منظمة الصحة العالمية. تم إعداد مخطط عمل للفترة الممتدة بين سنة 2022 و 2025 يقوم بالأساس على المنع الكلي للتدخين في الأماكن المغلقة وتكثيف التحذيرات الصحية والترفيع في الأداءات الموظفة على التبغ ب20%. أما بالنسبة لسرطان الثدي فهو يمثل 38% من أنواع السرطانات التي أصابت المرأة في تونس سنة 21 و2000، وتم اكتشاف 3684 حالة جديدة من هذا السرطان سنة 2021، في حين يمثل سرطان الرحم 3.6% من أنواع الإصابات بالسرطان لدى المرأة التونسية. في هذا الإطار تشارك تونس المجموعة الدولية للاحتفال بشهر أكتوبر الوردي الثدي لدى النساء خاصة منهم الشابات. أما فيما يتعلق بالسرطان لدى الأطفال دون السن 15 سنة فإنه يمثل تقريب 1.4 من جميع السرطانات المسجلة بتونس، وقد تم اتخاذ العديد من التدابير الرئيسية لتعزيز رعاية الأطفال المصابين بالسرطان، من بينها إنشاء سجل وطني لسرطان الأطفال وتوعية وتدريب أطباء الرعاية الأولية وأطباء الأطفال على التشخيص المبكر لسرطان الأطفال وتحسين جودة الرعاية ومضاعفة وحدات وخدمات أورام الأطفال، فضلا عن تحسين المتابعة من خلال الكشف في الوقت المناسب عن مضاعفات هذا المرض الخطير وتأمين إحاطة نفسية لمرضى السرطان. السيدات والسادة، أن هذه التحديات الصحية المتعلقة بحماية الشباب والأطفال والمرأة من مرضى السرطان بمختلف أنواعه لا تعترف بحدود الجغرافيا، بل هي هموم جميع سكان العالم ومشاغل يجب أن تعزز لدينا الإيمان المشترك بقيم التعاضد والتضامن والتعاون من أجل مستقبل أفضل للإنسانية جمعاء وفق رؤى وتصورات جديدة تعزز منظومة حقوق الإنسان في كونيتها. ونحن مدعوون اليوم أكثر من أي وقت مضى إلى تعزيز فرص الشراكة الإقليمية والدولية والانخراط الفاعل في كل الجهود وتوفير الدعم الضروري للإنسان الذي يمثل الثروة الحقيقية والدائمة للقارة الإفريقية من أجل بناء مجتمعات سليمة وأكثر توازن ونماء، وذلك بتأمين الحق في الرعاية الصحية في كل مكان وفي كل زمان. وشكرا جزيلا.
Thank you. Thank you so much for sharing the Tunisia experience. We are unfortunately getting close to the end. This conversation could have gone for an extra hour, but I know how committed you are to other programs. So we'll leave the floor open for one more remarks. If anyone wants to, looking behind me as well, anyone wants to take the floor, and that will be, yes, please, at the back end, and then we will summarize and bring the session to a close.
Hi, everyone. My name is Kathleen Schmaler. I'm from MD Anderson Cancer Center in Texas. I'm a doctor. I'm a cervical cancer specialist. And every time I see a patient with cervical cancer, I realize how much our system has failed them. And whether that's in Houston, Texas, in Maputo, Mozambique, or anywhere in the world. So I just want to congratulate all the First Ladies, especially our First Lady, Dr. Biden, for bringing the awareness of cervical cancer. At MD Anderson, we're very fortunate to have a 10-year relationship now with the Ministry of Health, and very much at the initiative of the First Lady. And so we're very lucky to work together, and it takes all of us, the doctors in the cancer centers, the governments, the First Ladies, our industry partners, and a big thank you also to our U.S. government for investing in this work in Africa through USAID, PEPFAR, and the National Cancer Institute. So thank you very much for having me today.
Thank you. So I want to be sure that all the First Ladies who wanted to say something, share their experiences, have had the chance to do so before we close. So if not, I think it will be impossible or probably a mistake to try to summarize what I've heard this morning, really rich. But let me share some reflections that I heard from all of you, the wisdom that I heard from all of you, that leadership matters in the fight against cancer, no matter how challenging it is in the countries that you lead. I heard two types of leadership: resilient leadership that can enable you to get to close to 90% vaccination, and innovative leadership. I also heard cooperation, working together, that this group has the power to use your different platforms that you have, your megaphones, to make a difference. I heard from you all talked about not wasting the capital that you have, the social capital that you have, but spend it in several key areas of the fight against cancer: sensitization and awareness, access, especially in difficult to reach areas of the countries, remote areas. Have the courage to make sure that stigmatization, those barriers against cancer are broken, especially stigmatization, early screening and detection, advocacy, but building also facilities that will enable treatment and access. You can use your your platforms you have, your social capital that you have, to continue to address these issues. Excellencies, it's truly been an honor to listen to all of you, learn from you all, and I'm sure that the First Lady, Dr. Biden, will use all of your experiences to continue to build a momentum for the Cancer Moonshot project. I've been told that we will ask others to leave, but that you, Excellencies, First Ladies, you just stay seated as others leave the room. Thank you so much for your great contribution and for sharing your experiences and, more importantly, the wisdom in guiding the fight, a collective fight against cancer on the continent of Africa. Thank you so much.